I'm Rebecca. I'm trying to learn medicine today, Achalasia of Cardia and acid regurgitation. And after we've done that, we're gonna do leg injury prevention training. And if you participate in the leg injury prevention training, then it's at your own risk. We're talking about internal anatomy, illnesses, and this is no medical advice, we're just learning about it. And this is part 2 of included of a joined together part of Achalasia of Cardia and acid regurgitation. Now we want to make a presentation and saying Achalasia of Cardia versus acid regurgitation, or maybe also that. Okay, what do we say to the symptoms? So first, by Achalasia of Cardia, after the swallowing, the peristalsis movement doesn't properly push the food down into the stomach. The sphincter at the end of the esophagus is too tight and the food doesn't come into the stomach. Acid regurgitation, where the muscles at the lower end of the esophagus are too lax and the food and also the stomach acids can come back into the esophagus. And that can cause acid regurgitation, can cause peptic and reflex esophagitis. Anything more? And stricture esophagitis and Achalasia of Cardia with a feeling of a food stuck behind the breastbone can because the food can be then breathed in into the lungs, pneumonia and bronchiectasis, and also an increased risk of esophageal cancer exercise. Symptoms. Acid regurgitation has just a burning sensation behind the breastbone. Taste of food and acid, maybe. Burning sensation, more burning sensation behind the breastbone and more taste of food and acid. But I'm not sure. Burning sensation of food and acid and Achalasia of Cardia, that is more feeling of food stuck behind the breastbone. Difficulty in swallowing, chest pain. Okay. Complication treatment in the home. By both is it advised to eat small meals seated. Achalasia of Cardia, there can be made a cut into the sphincter to let food better pass. Do the people after they had the Achalasia of Cardia surgery at the sphincter with a cut then acid regurgitation? What if the two diseases is more severe? Maybe it's individually, but in general. Okay, I think we have it. Let's try it, and when we're gonna see it is advised to take smaller meals and eat seated up. We don't want to end on that, because this is not about the symptoms, this is about more the cause of it, more of the disease itself, not a little bit the disease itself. Let's just try it. Facing camera, I'm going to start now. And let's start. Achalasia of Cardia and acid regurgitation. Achalasia of Cardia, where after the swallowing the peristalsis movement doesn't properly push the food down into the stomach. The muscle sphincter at the end of the esophagus is too tight and the food cannot pass into the stomach. By acid regurgitation, the muscles at the lower end of the esophagus are too lax and the food and the acid content of the stomach can come back into the esophagus. Acid regurgitation has more of burning sensation behind the breastbone because of the acids. It was in the stomach. And also taste of acid and food. Achalasia of Cardia, more of food stuck behind the breastbone. And acid regurgitation can then lead to peptic and reflux esophagitis, and that is also stricture of the esophagus, and that is esophagitis that is inflammation and ulceration of the lignin of the esophagus. And the other one, achalasia of the cardia, that can cause, because the food can be breathed into the lungs, bronchiectasis and pneumonia, and also an increased risk of esophageal cancer as well. All over here, there's advice to take smaller meals seated. And that is according to Keith Hodkins, Family Medical Advisor, page 60 and 61. This is no medical advice. There's a lot of information, so I don't think it is a problem that I'm a bit slow. I stop for a sec. And I have a second one running, and now we're going to do the other thing, which is the leg and regurgitation. So, that means if you're here for medicine and you want to do the thing after cataract and alphabetical order, then you can go directly to the next part of medicine, where we have the next thing about medicine. We will do now the leg injury prevention training. If you stay and participate in the leg injury prevention training, then it's within the honors. We're starting with bringing one leg up, the mushroom, the pointing of point. We're continuing with bringing the other leg up and with pointing of foot. And now take the leg at the ankle. Make a straight back. And point with the knee down to the floor. Great. Now take the other leg at the ankle. Make a straight back and point with the knee down to the floor. To the next exercise, the direction boy. One leg up into the right finger, arms out, and you're bringing them over to one side. And we're going back into the middle and over to the other side. Back in the middle, and we're changing the same with the other leg. Bring the leg up, hands out, and bring them over to one side. Over to the other side. Back in a little and down. And now one leg up again. And out leg to the side. Pie and back row, breathe again in. Out into the middle and down. And another time, leg up, breathe in. Out leg to the side. Breathe again in. Out in the middle. Down. Other leg up, breathe in. Out. Again. Back in. And down. Lower. Again. Out. Breathe again in. Out in the middle. And down. Next exercise. Slash and backslash. Leg up and we're pressing the inside against the knee. Right angle of the leg, flex foot, even line tips taller of the back, little bend in the other one. And the other angle. And press on the inside. Right angle of the leg, flex foot, even line tips taller of the back, little bend in. And to the next exercise. One more like that, leg up and we're pressing with the knee up to the side. And now with the other knee. Knee up. And the knee presses up the side. And to the next exercise. To the stand. Knee up and knee down. Knee up and down. And the other knee up and down, up. And now you can continue with the step, or you do the horse, knee in, out, in. And up the other leg. And now You can do the horse over step. We're doing the camel knee up, downward step. We're doing a movement with the whole body. And with the other leg. And the last exercise, the chunky flat legs by the parts. We breathe in, count down. And breathe out. Again, in. Out. Out. Breathe in across the legs. And out. That was the leg intervention training. I thank you very much and until next time.